My name's Stephanie-Rae Flicker. I am a new graduate, well, so I was a new graduate last year, veterinary surgeon, and I'm working currently in a very busy small animal hospital in East London. So a lot of my EDI involvement initially started when I was still a student at university at the RBC. And so I was involved already as a student ambassador, helping the RBC Access team with sort of widening participation work as a student, which that was something I was quite passionate about when I first started. I also came via their Gateway program as well, so which was a program that was meant to help get sort of underprivileged students into veterinary medicine. And so I thought I could give back in that way initially. Later on throughout my time, I got more involved with Animal Aspirations, which was a student-led organisation who tried to reach out to less more underrepresented students in schools and things, and we put on events where we'd go and talk to them about veterinary medicine, about veterinary careers in general, which was really good. And I think obviously at the time of COVID and when we had sort of BLM movement and things going on, that group became quite a voice, I think, at the time for trying to get our university particularly to reconsider their EDI policies and consider how they're best supporting students on placements when they encountered sort of, whether there was discrimination based on ethnicity, race, any sort of other protected characteristics as well. I also then was a member of the Students' Union, and I had a representation and communications role. And within that role, I kind of ended up still getting segued into doing further work, both the president and the EDI officer at the time. It kind of led to being involved with the Vet Schools Council roundtable that they introduced to discuss and kind of have an intervention with regard to supporting BAME students. And then I kind of later on then moved on to taking on a co-chair role with their student working group, which has led to us being able to develop and strengthen the EDI considerations across all the veterinary schools as well. So I think for me, it's obviously providing a sense of belonging. It's really, really important, I think, that you see people in your workplace. I knew when I started at uni as well, it was important to see people that look like you or, can have shared experiences with you as well. So there's value in that. And also just it's a more positive and nurturing culture if you're you're valuing what people bring to the table when they're at a workplace as well. I think it's important for anyone starting a role to kind of look at their EDI policies and know that it kind of matches with their own values and what they would expect and how they expect to be treated and how then they expect to treat others as well. I think for people where you might have had previous experiences either as a student that weren't as favourable for you, it's important that if you've got an opportunity to have a level of control over where you're going, you have a look at those values. Do they have sort of, is it sort of laid out in pillars? Is it laid out as, is it a policy document that gets reviewed? But then also actually they're showing active encouragement of everyone in the workplace to take up those values. It shouldn't just be the people that are affected or would, value the most from those policies. And I think as well, from discussions with other people, actually, it's important that your EDI values, you follow them as a staff member at your workplace, but also it means you then respect backgrounds and discussions you have with people that are your clients, particularly from a veterinary perspective. I find that working in London as well, you're working with such an expanse and areas which are so rich in different cultures and backgrounds that actually you need to think about how you approach your cases and the sensitivity, empathy, tolerance that you have towards those people and what you're doing when you have your discussions with them as well. Yes, I've had to think about a few things. So I think it's important that you acknowledge people when they show up and when they're and they're doing good work. When people might be faltering, you realize that and you ask them, how else can we help you? It's going to sound probably very generic things, like things that you should be doing in a workplace anyway. But I think from the perspective, if we're talking about, people with related to protected characteristics, so considering sort of maybe sort of chronic illness support and disabilities as well. Also, if people are kind of going through sort of, not so great mental health phases and things like that, that is just as important. Providing reassurance for people that there is support that they can get, either that the practice can offer, or will signpost you to either the things that we already have in place, or external groups or support resources that actually are going to help someone get back on track as well. Because I think we sometimes have to acknowledge that we aren't always your workplace, if you don't if you think about, if your practices and policies aren't up to date necessarily, you acknowledge that, and then you make sure that someone gets the help that's most appropriate for them. I guess as well, so open discussions, forums, and actively engaging people to develop the concept for the workplace as well. What does positive identity mean to everyone in the workplace? What does positive identity mean to people that, maybe have other shared and lived experiences as well? And you can't necessarily obviously force everyone to open up. That wouldn't be beneficial in that exercise, but at least you are having an offering there, and you're saying, I'm here to listen to you, and work together to build this environment that will help you thrive at your workplace. Continued learning and education, definitely. So like I was saying, if you feel that your EDI policies might not be up to scratch, and I feel like particularly in the last few years is when you're now going to have seen such a wealth of information come through. The EDI policies in most places are probably quite out of date, and might not necessarily reflect things how they were, if they were from maybe sort of like 5-10 years ago. So it's keeping up with those as well. And then I guess just identifying targets for improvements. So if you've had people report discrimination in the workplace, if you've had people have personal doubts about their own performance in relation to those aspects, and kind of developing those support protocols through external consultancy as well. And auditing and gathering feedback as well is important, and making sure you're going through. I know that when we've spoken a lot about EDI, we try to avoid the thoughts of, it's not tick box exercises. It's not just trying to count and tally how many times have we had this, how many times have we had that. You do really need to look at any verbal communication and feedback and pull that apart as well. So I think probably for a lot of people, their first source is going to be, you want to kind of find valid and vetted EDI training programs, things that aren't static. So, we don't want programs that say, I've done this course, I am now, 90% competent at being able to deal with someone that's might be going through a situation or going through a particular scenario. You kind of want to be able to have accreditations. But I guess the only way of knowing is to make sure you communicate with other practices and see maybe if they've tried EDI programs. Obviously, if organisational bodies like the RCVS, DVA, any other of these sort of larger veterinary organisational groups have resources on training that they use and how to kind of filter that into your workplace, that is going to be quite beneficial if you don't necessarily have a baseline of somewhere to start. Sharing resources, especially if they are ones that have elements of, personal anecdote and experience that have been shared with permission, because a lot of the EDI discussion will revolve around that not everyone experiences these things, and therefore people that have not personal experience and need to try and learn how to put themselves in that person's shoes when they've gone through an experience. And so finding that will be very, very important for any leaders that are going to end up, have maybe sitting down, having a discussion with someone that has reported that, I feel out of place. I've been discriminated against. There's things about working here that I'm not so happy about. And it's also just making sure that enough time is allocated to those programs, to those discussions, because I think as well, like where we've had such a boom in focusing particularly sort of on mental health issues and things, everyone really values it, sees the value and importance of allowing people to have, time off when they need to have time off, signposting the resource and things. It requires, that same drive and effort to make sure that they are worked on appropriately, and it just means that you can then develop your skills better. And then I think, yeah, also, I guess you almost maybe have to incentivize and encourage leaders and people in the workplace of thinking about how, if you put that time in now, your practice in the long run will, your practice, your workplace will gain a lot from it. So increased satisfaction of the people that are working there, increased retention as well, and just stronger relationships within your team. People feel like they don't just necessarily have to come to you to talk to you. I can speak to anyone because everyone's had the training, and everyone feels that everyone shares and underpins the values that they go through day to day. Yeah, so I think that I think from my personal perspective, I've not ever really had any formalized like EDI training, and I would love to like develop that one day as well for myself, because I feel like the way that I've got into it is through circumstances of things that I was working in and involved in, and I've had that interest anyway. And so I've been able to develop it with the avenues and the opportunities that I had whilst I was a student at university. So I think, particularly when you're a student, there needs to be flagging up of opportunities for training if your university were to offer you EDI training, likewise if you were doing the same in the workplace. But I also think people need to appreciate, you kind of need to unlearn that there might be an assumption that people of underrepresented backgrounds will always want to be involved in the leading or teaching of these exercises. And likewise, you would still benefit from training even if you've had these personal experiences, and don't always make the assumption that people from underrepresented backgrounds necessarily want to open up about those experiences. They should be validated. If someone says, things have happened, but I just would rather not share, that's fine. You can respect that. But I think we need to make sure that actually we are finding ways of getting more people on board with it. I think that kind of segues onto how maybe within the education, within the curriculum, how do we better introduce EDI? Do we introduce it sooner into our training, sort of vets, nurses, and other like veterinary professionals? So we know that we do have a lot of professional studies related work that goes on, but I wouldn't necessarily say at the moment that equality, diversity, inclusion is covered in that. Whether or not it's something that, again, it's up to the schools to decide how they structure their programs, but it might be a way of making sure that everyone's had a level of EDI training to at some point in their veterinary career. Also, I guess it's understanding barriers to success related to your background, considering equity. Not everyone has come from the same places, not everyone has the same privileges as other people, and that goes the same way in trying to get people into leadership roles in general. So people will be able to see it in the workplace, who are your board of managers, who are your clinical directors, etc. If it's people that kind of fit the same makeup, that's something that workplaces and people that are working in education as well need to reflect on, and consider where underrepresented members should be able to kind of take up space almost, where you might otherwise not see them as much. So I'll try and keep them short and sweet. So I think that I would say, you need to be open-minded, and you truly need to listen to what people have to tell you, almost kind of have your clinical brain off a little bit, particularly if it's from a veterinary perspective, and kind of, it's you have to kind of practice these elements of tolerance and empathy, and understanding where, like I said before, you all have privileges, and we all have different privileges, but you have to see how people have these different experiences, how you may not have experienced them. You don't invalidate that, that they've had these experiences, but you can figure out ways to learn from them, how to recognize them if they occur to other people as well. There's really, it's important that you almost can kind of pick up and read signals from people if they are going through a time where they're trying to keep something to themselves. They'd rather not talk about it. And I think particularly with EDI related work, and I guess from a perspective of where discrimination, if we go down that avenue, not everyone feels that they can go and speak to people in their workplace, or particularly what we found when we've done the work for the BAME student group, not all students feel like they can go and speak to certain people about the experiences they've had because of relatability, or, you know, just the fear of being kind of pushed away, or it kind of being, you know, it's not being dealt with appropriately. So I think there needs to be consideration for that. Understanding intersectionality is really important as well. You know, my problems aren't the same as your problems, but ultimately there's still an issue that needs to be resolved, and also the impact that having, you know, being you know, having these other characteristics that impact your experience as well, they also need to be taken into consideration too. But it's a matter of everyone being involved, everyone taking on the education for themselves, not relying on people, you know, to open up. You know, you need to kind of take an active stance in looking and reviewing your EDI policies, and, you know, just trying to make the workplaces, make education more favourable for everyone, really.